Typically, folks with early memory impairment, we're going to notice a forgetfulness, short-term memory problems. They'll forget a conversation. They'll repeat themselves more often. They'll forget where they placed items. Over time, we might see more of a tendency to become disoriented or lost while driving, have difficulty navigating from point A to point B.
But when he began saying things like that, like, I just can't see where I need to go, what turns I need to make, that was a little disturbing because, being the man, he was always the driver, like, ooh, okay, this could not be too good.
There's more and more evidence of various lifestyle changes that we can make that can reduce our risk of having significant memory problems as we get older. Better physical activity, social activity, being involved socially, interacting with people, and being stimulated mentally. Now, beyond that, it's also important that we pay attention to what we think of as vascular risk factors. Don't smoke. Make sure our blood pressure is under control. All of those things, if we keep that in check, almost certainly I think we reduce our risk of developing a dementia.
Well, that's a good way to begin, and my first guest is the star of that video, Dr. Greg Cooper, who's a neurologist, who's the director of the Memory Care Center at Baptist Health Lexington. I think I got all that right.
You did.
All right. Now, you talked a little bit about dementia, memory, Alzheimer's, cognitive impairment, senility. We hear a lot of terms. Is there the right and the wrong way to categorize things?
All of those are reasonable terms. Generally, we think of a spectrum. So we can have normal aging, and there may be some changes that go along with normal aging, but they're pretty slight. If we develop a little more memory difficulty, a little more cognitive difficulty, we'll often refer to that as mild cognitive impairment. And if that progresses a little farther, we may say that someone has a dementia. That's a condition where someone has impairments in memory and cognition to the degree that it's interfering with their day-to-day function. Think of dementia as a broad term. There are multiple causes of dementia. Alzheimer's disease is what we most commonly think of, and that probably accounts for about 80% of cases of dementia.
But there are other causes too. That's just the most common we hear about.
That's correct.
Okay, now, sometimes I find myself being pretty forgetful, and I worry, am I developing this? I guess we all have those thoughts.
That's
but what
true.
are some early signs that maybe this is more important?
Well, if we forget things from time to time, misplace things from time to time, but maybe it comes back to us, that's usually more a sign of normal rather than impaired cognition. If we have trouble coming up with someone's name, that more often than not is going to be normal. And if we're the ones that primarily have the concern, that often is normal. It's when others are more concerned about us. If I don't really think I have much trouble, but my family is very concerned about my forgetfulness, I forget conversations, events, and those don't come back to me. I don't develop a remembrance of those things. That's a little bit more concerning.
Okay, so if we wanted to prevent it, are there things we can do?
While there aren't definite strategies, there is increasing evidence that there are things we can do. So first, we want to have good general health. We want to make sure our blood pressure is under control, our cholesterol is under control. If we have diabetes, we want that to be controlled. We want to avoid smoking. We want to avoid excessive alcohol intake. Then beyond that, there are certain lifestyle changes that we can do. And it sounds very general, but we just want to be active. We want to be active physically, mentally, and socially. Doing all of those things, we think, helps lower our risk of cognitive decline later on.
Well, one thing that I want to get to that I hear a lot in my practice is, okay, my mom can't remember, she can't think, I'm worried about her driving. Is that something we need to worry about?
It often is, and that's a very difficult thing to sort out. There's not a simple test that tells us when someone is able to drive and when they're not. Often, if someone has very mild problems with memory, it may be safe for them to drive in limited situations under good driving conditions, known routes. But if that starts to become more serious, we need to look at it more carefully. That may involve just asking family to ride with that individual and get a sense if they're safe. That may involve referring someone for a formal driving evaluation to really monitor that safety. But that's really something we want to pay attention to, and it's better to act early than wait and let that get out of hand.
Act early, stay active, stay healthy, use your memory.
Absolutely.
All right. We'll be